Hi friends, welcome back to another video. If you're new here, my name is Amanda, registered dietitian and mom of two. Most of the advice we get postpartum is all about baby. Their feeding schedules, their sleep schedules, the best exercises for tummy time. But what about mom? One topic I rarely hear anyone talking about is bone health. I have spent the last few years working primarily with women who have been diagnosed with osteoporosis. And if I can, I want to help you protect your bones. Did you know in the first 6 months of breastfeeding, postpartum moms can lose up to 4 to 6% of their bone density? That's massive compared to the tiny changes we see year to year in normal aging. Today, I want to talk about calcium, bone health, and nutrients to support strong bones because you, mama, your health matters too. During pregnancy, your body needs to support your baby's growing skeleton, especially in the 3rd trimester. But here's the fascinating part. Your bones don't get the biggest hit here. That's because estrogen levels are very high in pregnancy and estrogen is bone protective. Instead, your body adapts by absorbing more calcium from your diet. Vitamin D and estrogen work together to increase intestinal calcium absorption so that you can meet baby's need mostly from food and not from bone breakdown. After birth, things flip. Estrogen plummets and prolactin, the hormone that drives milk production, rises. Prolactin stimulates a hormone known as parathyroid hormone-related peptide. This hormone stimulates the release of calcium from your skeleton into the bloodstream, which then enriches the breast milk. That's why bone loss happens primarily in lactation and not during pregnancy. To put that into perspective, after menopause, women typically lose 2 to 3% of bone density per year because estrogen drops. So postpartum bone loss is like cramming 2 years of menopausal bone loss into just 6 months. The good news, for most women, this is just temporary. Once you wean and your menstrual cycle returns, your estrogen levels can start to rise again, which then helps rebuild bone. The recovery time is about 12 to 24 months. So how much calcium do you actually need in a day? For women between the age of 19 and 50, including pregnancy and lactation, we want to aim for 1,000 milligrams of calcium per day. Now, when I work with my postpartum moms, we really prioritize food first. Here are my top calcium-rich food recommendations. Dairy, like milk, yogurt, and cheese, or fortified soy milk. Leafy greens like bok choy and kale, but not spinach as it's high in oxalates and that can block calcium absorption. Canned salmon or sardines with bones. Calcium-set tofu. Nuts and seeds like almonds, sesame seeds, and chia seeds. And even figs and blackstrap molasses. And a quick tip is that your body can only absorb up to 500 milligrams of calcium at a time. So spread your calcium sources throughout the day instead of having everything in one meal. If diet alone doesn't get you to 1,000 milligrams, then supplements can help. If you're going to be purchasing a calcium supplement, the form matters. Calcium citrate is quite easy to digest and can be taken without food. Calcium carbonate, on the other hand, needs food in order to be absorbed properly. And some other nutrients to consider when it comes to bone health include vitamin D, which is a sunshine hormone. Now, with vitamin D, don't guess the amount that you need. You want to test it first. But vitamin D is very, very critical in helping your body absorb calcium. Another nutrient to consider is magnesium. Magnesium helps to activate vitamin D and also is part of the bone matrix. Most female needs anywhere between 200 and 400 milligrams per day, and there's also different forms of magnesium to consider. I love magnesium glycinate as well as magnesium citrate because they're very, very easy to absorb. Lastly, vitamin K2. You can think of this as the calcium traffic cop, making sure the calcium that we get from food and supplements goes to our bones and not to our arteries. Now, one final note is you don't want to be taking all these minerals like magnesium and calcium all at once because they will compete for absorption. So it's best to separate these minerals. So perhaps calcium during the day and magnesium before bed. Supplements are only part of the picture. Lifestyle matters as well. let's go through 3 major factors. Number 1 is weight-bearing exercises like walking, dancing, and lifting weights. This will all help build bone. Number 2 is getting outside and getting some sunshine and fresh air. Remember, vitamin D helps your body absorb calcium. Thirdly is eating enough protein. Protein will help drive collagen, which is part of the framework of your bones. And here's something really important. The return of your menstrual cycle is one of the strongest signals that your body is recovering. As estrogen rises, bone resorption slows down and rebuilding kicks in. So if you haven't had your menstrual cycle return after many, many months or even years, you may want to go to your doctor and get that checked out. Now, if you're planning to conceive again soon, maybe within 1 to 2 years, bone health really matters. Bone density can take anywhere between 12 and 24 months to recover. And if you get pregnant before you've had a chance to rebuild bone, then you'll be starting your pregnancy at a lower baseline. So here are a few things to watch out for if you are planning to conceive again. This doesn't mean it's unsafe, but you really want to make sure you're prioritizing your intake of calcium, vitamin D, magnesium, vitamin K2, and also making sure that you're eating protein-rich meals. And lastly, incorporating weight-bearing exercises when you can. Think of this as refueling your gas tank before your next big road trip. One last thing before we end today's video, and it's something really important, because I hear this a lot from moms, is that they'll say, I got blood work done, my blood calcium levels are totally fine, this should mean my bone density is good. Unfortunately, this is not true. Your body tightly regulates the amount of calcium in your blood, so if you're not getting enough calcium from your food, it'll just drop from your bones. So even if you had a perfectly fine reading on your blood work, your bones could still be thinning. The best marker for bone density is still a DEXA scan. Most people don't need a DEXA scan too early on, but if you do have a family history of osteoporosis or maybe an eating disorder, or maybe your menstrual cycle still haven't returned after many years, or you've had oral steroid use, then it may be worthwhile to look into. So let's do a recap. Number 1, bone loss during breastfeeding is real. Women can lose up to 6% in that first 6 months, even if it's just temporary. Number 2, prioritize nutrients like calcium, vitamin D, magnesium, vitamin K2, and make sure you eat enough protein at every single meal. Number 3, move your body and pay attention to your menstrual cycle. And lastly, if you're thinking about having another baby soon, really prioritize these 3 things. Taking care of your bones now isn't just about preventing osteoporosis. It's about building strength and resilience so that you can raise your little ones. If you found this video helpful, like, subscribe, and share with another mama friend. Thank you so much for joining, and until next time, relish every bite.